So what are the options when it's been determined that you have to remove all their teeth and you're going to give them new teeth supported by dental implants, or the denture wear?
Well, they can go different routes.
Okay.
The first route is a snap-in denture. It's not my favorite route. Right?
Okay.
These are patients that it's immediate satisfaction, right? Because you're taking out their teeth, you're putting in 2 implants, and you're securing a denture that's non-removable in their mouth.
So it just snaps in and snaps out.
It snaps in and
Okay.
snaps out. But what happens, Randy, is throughout the months, their denture, that denture is tissue supported, right? So your bone's going to keep resorbing. And every time they go to bite into an apple or into food, it's going to pop out. So that is, they're going to be living in the office, right? Because they're going to be coming in every 6 months, talking, wanting to add, for you to add more material. The attachments pop out. That's definitely not the best route to go. So the second option, you can make it a little bit more snug, right? And prevent bone loss by putting a bar. But guess what? It's still going to be taken in and off, right? You're still going to have to remove it at night. It's still going to be acrylic. It's going to be porous. It's going to smell after a certain time. It could break. It could fracture because of the bar, right? And the third option is what we like to do, right? We mill them one piece, right, of a customized smile that we create off their facial features, and we're able to give this to them, and they don't have to remove it. And they smile, and it looks just like their teeth. It is their teeth. I mean...
And they can eat whatever they want.
Yeah.
Once they're healed up, I mean, they can eat
with
whatever
two
they
more
want.
implants. With 2 more implants. Just instead of putting 2, you just put 4, and that's it. So it's not even that much more of a surgical procedure. It's just a no-brainer.
But isn't that what everybody wants anyway? Teeth that don't come out?
Yeah, yeah.
So what is the other option? The snap-in denture is just cheaper.
It's cheaper. It's
and
cheaper.
easier to do for the dentist?
It's cheaper. It's easier, and you got to understand there's levels to this, right? When you start placing implants, that first level after you start placing your single implants is snap-ins, right? After you realize that snap-ins are not what's best for the patient, then you start studying how to do the non-removable implants, and those are done by the experts.
That's what you do at your office. I mean, everything is teeth that don't come in and out.
Yeah,
is that right? Okay.
We don't want our patients leaving the office with acrylic or with removable teeth.
Okay. You do that all the time?
All the time, every day.